Welcome to Applying ACCME Commendation Criteria, one of the Sharp Healthcare Faculty Tip Series videos. The purpose of this module is to provide a framework for CME and content developers to be able to apply a wide range of strategies to activity development and execution of those activities that meet the new ACCME Commendation Criteria that were adopted in July of 2017. The ACCME, or the Accreditation Council for Continuing Medical Education, sets standards for all accredited organizations with which they must meet in order to offer AMA PRA Category 1 CME credit. There are the general standards, or the basic standards, that all organizations who are accredited by the ACCME that must meet. The commendation criteria are optional. However, Sharp Healthcare has been accredited with commendation over their last two reaccreditation cycles, and we remain accredited with commendation until November of 2022. These commendation criteria, however, have changed recently, and with our reaccreditation in the next cycle, we will be expected to meet these new criteria. As part of that, we hope to educate many of you as faculty and activity moderators and activity chairs to find ways to integrate some of these commendation criteria into your activities to help us achieve and maintain continued commendation. The basic standards, of which there are 13, here are the first 5, which discuss topics or set guidelines for things such as the CME mission statement, how the educational activities are designed relative to what the needs of the learners, so the physicians and the other healthcare providers are. We also want to make sure that those design contains efforts to change competence or how we do things, performance, the ability to actually do something different, and ultimately patient outcomes, making sure that patients are leaving the hospital faster, feeling better sooner, returning back to their activities of daily living sooner. And number 5, we want to make sure that the formats and the intervention types that we use are appropriate for the goals that we're trying to achieve and the results we're hoping to achieve. So it doesn't mean that every CME that we do is going to be a lecture. Maybe some of them are online, maybe it's a workshop, maybe it's a role play, maybe it's some sort of simulation, or maybe it's on your mobile phone or on Twitter or Facebook. It all depends on what we or you as the activity designer may be trying to achieve for your learners. Criteria 6 through 9 continue, looking at the activities and wanting to make sure that we are addressing physician attributes that are set by the Institute of Medicine, the Accreditation Council for Graduate Medical Education. Things such as professionalism, communication skills, the ability to use informatics, the ability to do quality improvement, the ability to provide patient-centered care, to have a practice-based approach, but also have a system-based approach. Criterion 7 says that our activities are developed independent of commercial interests. This is where we need to make sure that while we may have exhibitors and advertisers at major conferences, they are not negatively or unduly influencing the activities that we design. And any individual who is involved in the planning or the execution of an activity must ensure that they do not have a conflict of interest that could potentially result in a commercially biased presentation. Criterion 8, also part of standard support, wants us to make sure that we are following all those major steps. And again, when we do have those exhibits, that they are separate from the education for Criterion 9. Now for Criterion 10 through 13. Criterion 10 is also included as part of the standards of commercial support. Criterion 11 requires that we look at the changes in learners' knowledge, behavior, or their ultimate patient outcomes to ensure that we're getting a return on our investment and that the education that we're completing is having an impact on the physician's behavior, their knowledge, and the type of care that they're providing. Criterion 12 asked us to look at our overall program and not just given activities and whether or not, again, they are providing effective changes in competence, performance, and patient outcomes. Criterion 13 means that we look at plans and we implement desired changes in the overall program to continue to grow the program and to make sure that it can continue to meet our identified mission. Part of that plan has actually been creating videos like this one for faculty and activity chairs to learn more about the CME process, to make sure that you have a more clear picture of what your role is, as well as our ability to help you achieve more successful activities. Again, as previously mentioned, all ACCME accredited organizations have to meet criterion 1 through 13. The commendation criteria, which are now going to be presented in video format by Graham McMahon, the President and CEO of the ACCME, again, are optional.
We're excited to announce our new commendation criteria. In this process to evolve commendation, we asked you to share those commendable practices in your institutions that the ACCME system should recognize and value. And we listened to you. This final version is based on much of the feedback that you've given us from the CME community. We wanted to ensure that the criteria would be attainable for all different CME provider types. The final version is designed to be both achievable and meaningful. Our goal in this process is to encourage the community to aim for even higher levels of achievement. And we really want to encourage and reward accredited CME providers for implementing best practices in pedagogy, engagement, evaluation, change management, and for focusing on what really matters to clinicians in generating meaningful outcomes. In the criteria, you'll see 16 criteria divided into 5 categories. Promotes team-based education, addresses public health priorities, enhances skills, demonstrates educational leadership, and achieves outcomes. You'll also see that we've designed the menu for flexibility. You should choose 7 criteria from any of the categories and 1 from the outcomes category, summing to a total of 8 of the available 16. We determined that 1 criteria from the outcomes category is mandatory for achieving commendation because the CME community needs to demonstrate the relevance, value, and impact of CME on our learners and the care they provide. Outcomes will enable us as a community to identify more effective ways of delivering CME and contributing to healthcare improvement. Each criteria is accompanied by a rationale, critical elements, and standards to help you understand and meet the expectations. And you'll see that the standards for compliance have been modified substantially in response to your extensive feedback. Engagement with the commendation criteria is optional. Organizations can choose to remain accredited by demonstrating compliance with our core criteria, numbers 1 through 13. We'll also have a transitional phase during which accredited providers that choose to aim to achieve accreditation with commendation will have the option of demonstrating compliance with the current or the new commendation criteria. I encourage you to review these criteria with your staff, volunteers, and leadership and discuss together how the criteria can support your strategic plan and determine which criteria are achievable and appropriate for you and your learners. Remember that we're here to help. We realize that choosing to achieve these commendation criteria might mean new changes for your work and your programs. We plan to do everything we can to support you and the CME community's successful adoption of the new criteria and evolve your educational strategy to meet best practices. We'll prepare educational resources and training for recognized accreditors, accredited CME providers, volunteers, and all of our stakeholders. Send us your questions and ideas for tools and resources that can help you create your implementation plan. Join our webinars to learn more and ask your questions. We appreciate your high level of participation in this process, all of your feedback, and we look forward to working together to ensure our community's successful implementation of the new criteria to achieve this shared goal of advancing quality and achieving outcomes in postgraduate medical education.
All right, to summarize, again, the menu of commendation criteria looks at a variety of mechanisms for recognizing and celebrating organizations that excel as CME providers and provide innovative and unique opportunities. Ideally, it's intended to reflect values and principles and aspirations that the community of CME providers share in recent years. For example, focusing on things such as community health, public health, engaging patients in the educational process, engaging students in the educational process. And ideally, hopefully, we're going to leverage the power of education to improve healthcare as an overall industry, and not just focusing so much on just improving physician behaviors or attitudes, but ultimately looking at the impact that that has on our patients and our communities. And ideally, we want to make sure that we're sharing and spreading best practices for educational practice and CME execution, as well as best practice for clinical care and patient care. Again, as a summary, the commendation criteria, the implementation was initiated in November of 2017, and as of November 2019, all newly accredited or newly reaccredited organizations must participate using the new commendation criteria. That means for us, when we get reaccredited in 2022, we will be being accredited under these new criteria. In summary, as mentioned by Dr. McMahon, it's a menu of 16 options in 5 categories with a description of compliance, including rationale, critical elements, and the standards. And we're going to go through each of those individually now so that you can learn a little bit more about each of those and maybe look at how you may be able to implement them in your activities and programs at your entities. So, the rationale provides us information on why the criteria was included as part of the commendation criteria. Ideally, this will reflect the focus of CME moving forward into the future and where it is moving as far as interprofessional education, engaging the community, engaging community groups, engaging public health opportunities, and looking beyond just the hospital or the clinic where the physician works, and engaging the team around the physician as well, and not just the physician, him or herself. The critical elements are the items that must be included for a given activity or series of activities that have to be checked off basically in order to make sure that that particular activity would qualify for covering a particular commendation criteria. And ultimately, the standard is how we measure whether or not we've met that given criteria. We may have an activity that includes all the critical elements and meets the rationale, but based on our size, and our size would be large, if we don't have 10% of our activities in this case, with the example that you see here for criterion C33, that meet all of these components, then perhaps we cannot utilize criteria 23 as part of our commendation application when we become reaccredited in 2022. All right, so how does this impact us? I've talked about that a little bit, and I just highlighted the bit about requiring 10% of activities a term to address criteria. Now, the word term in this case means the 6-year period in which we're accredited. This is not a year-to-year thing, so we have the entire 6-year reaccreditation period to make sure that we can meet these various criteria to the required percentage. Additionally, meeting the standard can vary for each criteria. And also, just because an activity meets one criteria doesn't mean that it would be excluded from meeting another. There may be activities that we have that are eligible that may qualify and help us meet more than one criteria that we've decided to take a look at. And you need to read the expectations carefully, as some criteria require a specific number of projects or activities, and in other cases it dictates that a certain percentage of participants or activities must meet the criteria. So, promotes team-based education is the first group of 5, and under that area there are 3 criteria. The first of which is C23, engages interprofessional teams. What you see listed here are the critical elements that must be included in an activity of any shape, size, or kind in order for it to be considered eligible under criteria 23. That means when you have your planning committees that you have planners for more than one profession. That doesn't mean having a family medicine physician and then having a nephrologist or a cardiologist or some other specialist. That means you have physicians, NPs, PAs, pharmacists, nurses, LVNs, physical therapists that are part of the planning committee depending on your activity and your group. All right, so you want different professions, not necessarily different medical specialties. You also want to make sure that the diversity of your planning committee is reflected in your faculty and that you have faculty from more than one profession. And that these activities should be designed to change competence and performance of that entire team, not just one particular individual in that group. So you're focused on improving team behavior and how the content that you're presenting could impact all of the different professions in the room, not just focusing on one particular profession, such as a physician or a nurse. Criteria 24 means that we engage the patients and the public. This may mean having planners on your committees who are patients or public representatives, say from the California Department of Public Health, or a local nonprofit that's influential in your community near your hospital. Additionally, perhaps these people or other people from similar groups or organizations are among the faculty. One of the things that we do encourage here at Sharp, and we have actually done in the recent past, is that there are times where we have patients come and speak about their experience to the physicians and other attendees at events in order to provide that additional perspective from which the physicians and others can learn. And finally, criteria 25, engaging the students of health professions. So this means we have planners and faculty who are potentially medical students, residents, interns, who participate in the process more clearly and engage from the perspective of what students can get out of this and perhaps what physicians need to know moving forward as they're getting the latest and greatest as they go through medical school. And maybe you've been out for a few years and it's good to kind of see what's coming up through the ranks. This happens a little bit for us with our pharmacy program, with the pharmacy residents and whatnot actively participating in some of our certified pharmacy education. However, because we don't often have residents or interns here, it's a little bit different here for on the physician side of things and the CME side of things. But it is definitely something we should consider and perhaps find a way to engage. The next group is addressing public health priorities. This again also includes 3 criteria. Criteria 26, incorporating health and practice data. This means using a Sharp system targets, performance targets. This means using your entity performance targets and dashboards. This may also mean looking at the community benefits report for all of San Diego County, or perhaps your neighborhood or your zip code, and looking at specific performance data from physician to physician and deciding what that means relative to what's being offered or what's being taught. Criteria 27, addressing population health. We want to make sure that we're engaging on topics that are huge in the public health arena, whether it's dealing with obesity, lack of exercise, social determinants of health, texting and driving, drinking and driving, whatever it is kind of the topic of the day. There are many. And we have started to do that here at Sharp for any of you who have been involved in the Food Insecurity Initiative and perhaps have participated in that education or are with one of the medical groups who are doing more to screen their general patients for that and not just specific patient types. And 28 says that we need to collaborate effectively. This means looking at who we're collaborating with to develop education. Are we just collaborating with people inside Sharp, or are we collaborating with other healthcare organizations, other community organizations? So maybe we're collaborating with the San Diego Hospital Association, maybe we're collaborating with the skilled nursing facilities that we potentially refer patients to once they are no longer in need of being in the hospital, but they need care before they can go home. What other organizations in the community are we working with? And how can that collaboration help us build an educational program and help us address population health issues? The next group is enhancing skills. Criterion 29 looks specifically at optimizing your communication skills. So anytime we do any type of CME where we're specifically teaching physicians and other healthcare team members how to communicate with each other, how to communicate with patients, how to communicate with those in the community, And we want to make sure that we can actually observe them in real time. So this may mean role playing or some sort of simulation, and being able to provide feedback in those situations as well. Criteria 30 says that we need to optimize learners' technical and procedural skills. Now, when I think of this, I think of simulation labs and those sorts of things, and I know that there are locations that have those. We have the ability to do this in very limited situations, but there are other ways to practice skills in labs via workshops and other activities. And so what are those skills that we need to know? What are those skills that are being practiced? And we're able to provide evaluation through observation, and then ultimately providing formative feedback or specific written feedback to the learner about their ability. Any activities in this such would meet criterion 30. The other two for enhancing skills: creating individualized learning plans. This means that a learner takes an opportunity to figure out maybe where their strengths and weaknesses are. They realize where their weaknesses are, and they work to develop a learning plan where they have repeated engagement with a particular curriculum or topic over several weeks or months in order to make sure that they really can understand that topic and they retain the knowledge and information. And ideally, the feedback that's provided to this learner is individual. It's not feedback that's provided to a group or summarized to a group. It's a one-on-one type of situation. The best example that I can provide of this, that an activity that may meet this criteria, is the collaboration that we're doing currently with the Clinical Documentation Improvement Group. There are clinical documentation specialists all over Sharp Healthcare, and when they meet with physicians, that's a one-on-one opportunity for those trainers and educators to provide feedback to a physician based on specific records and queries that they've submitted. Once they have that one-on-one education, there are also opportunities as new topics come out to access the CME portal online and complete 15-minute online modules around topics where they may need additional training. And queries will continue even after the education is completed. So if there continue to be struggles, there would be awareness based on the query process, and perhaps an additional one-on-one would be needed. Criterion 32 states that we utilize support strategies. These support strategies can be anything from pocket cards, wallet cards, email reminders, posters, signage for patients, handouts for physicians, that provide additional information related to an activity that's been completed, and it doesn't necessarily qualify for continuing medical education itself, but it's additional resources or references related to an education that just happened, so that a physician or another provider can access that information regularly to make sure that they're continuing to use that new information accurately, and they can develop strategies and plans for improving. The next group is demonstrating educational leadership. Now, Sharp Healthcare, as far as criterion 33, does not currently extremely actively participate in research or scholarship. However, this is something that we're looking at, whether we start publishing case studies, whether we start doing some research around different educational and pedagogical methods. But there is an opportunity for us to, quote-unquote, earn credit under commendation criteria for doing research and scholarship. So I would encourage you, if there's any physicians out there that have an interest in this component, to reach out to us. We would be happy to collaborate to start to grow this process. Criteria 34 is support for continuing professional development for the CME team. And while many of you as activity chairs and moderators and participants may not be aware, the members of the CME department do often get opportunities to travel locally, regionally, and sometimes nationally to participate in CME professional education from experts around the country. Additionally, we do design regularly internal professional developments to keep up with the latest trends in CME, and also to analyze our processes and procedures and figure out ways to be more innovative in the education that we provide to you. Criterion 35, speaking of innovation, speaks directly to creativity and innovation. This is an opportunity for us to look at what we're doing and what we could be doing, and how perhaps we can do something different and new that no one else has ever done. Whether it's using technology in a different way, whether it's engaging educational leaders like yourselves around the system in a different way, whether it's engaging learners in a different way. The sky is the limit. And so we encourage you to reach out to us with any ideas that you may have about different ways that we can complete CME that we're not already utilizing. And finally, the last group is Achieve Outcomes. As Dr. McMahon mentioned, we have to choose at least one of these. Doesn't mean we can't choose more, but it is a requirement to choose at least one. Criterion 36 looks at improving performance. This is simply our ability to measure the performance changes in learners after they've participated in education. And what does that mean as far as change in behavior, change in what they know, and change in patient outcomes? Criterion 37 looks at improving healthcare quality. This would be looking at perhaps our performance targets either at the entity level or at the system level, and tying that to the different CME events and activities that we've had, and whether or not we've been involved in moving the needle on improving healthcare for our patients throughout the community in areas perhaps where we know we need a little bit of work. And then finally, Criteria 38 improves patients and community health. So again, what are we doing around the area of public health, which is a group from earlier, and how are we measuring what kind of impact, if we are doing those types of activities, that it's having on the community? Are we able to get more of the community exercising? Are we able to better recognize those patients who may be diagnosed or suffering from Alzheimer's? Are we able to refer patients to resources for a variety of social challenges, whether it's being food insecure, whether it's lack of transportation, whatever the case might be? All right, so in summary, that is all 16 criteria. To give you an idea, once these criteria came out, the CME team sat down together and we reviewed each of the criteria, and we talked about which ones we thought we could most likely meet the standards and the critical elements. Of those, you see 9 listed here, which includes at least one outcomes measure, and that means there's more here than we need, because ultimately at the end of the day, we only need 8. But please take a look at this list and think about the things that we've discussed as examples of how to meet the different criteria, and think about how your activity could fall under one or more of these categories. Perhaps it just means we need to do a better job of downloading data that's available for the physicians who are participating in your education. Perhaps it just means we need to reach out to someone in the community or add a patient to a planning committee. Many of the things that we can do are relatively simple and relatively straightforward, and it means that we're well on our way to meeting the commendation criteria. Again, as always, you're encouraged to reach out to CME with your ideas and concepts to see how we can put them into play. So if you do have any ideas, here's our contact information. Again, you can always stop by our office, you can give us a call, or you can drop us an email. Again, our website is available at sharp.com/CME portal. I did mention a variety of resources that are available on this topic. The ACCME, whose website is at www.accme.org, provides any number of resources specifically related to the commendation criteria and the accreditation criteria. I've listed some of the major ones here, but I encourage you to take a look at the website and poke around and see what you can find. Here's some specific documents from the website, some of which will look familiar to you, which you'll see the commendation criteria wheel, which you've seen throughout this presentation, as well as the larger packet of the major elements, the rationale, and the final details of what you need to do to meet each criteria. And finally, if video is your thing and you want to learn more about specific criteria within the commendation groups, go ahead and check out one of these video resources. There's one video for each criterion. And in some cases, if you go to the ACCME website, if you have questions about population health, public health, community health, and some other topics where maybe it's a little new as far as how CME ties it all together, there are additional videos available on those topics.